There are 8 primary ranges of motion that I'll use for the neck when I test range of motion baselines in part 2. But I want to highlight today that there are a select few patients for whom moving into those 8 directions is not especially provocative, if at all provocative. And for those patients, I may have us look at a more kind of comprehensive range of motion or a more outside the box one. For those patients, the problem is typically in the posterior lateral quadrant. So while I can test the anterior lateral quadrant if I want, most problems, especially mechanical joint disorders, present with problems in the posterior aspect of the joint. So if I'm not seeing a problem with extension and right side bend and right rotation, for example, but I'm curious and I think there's a problem, I may have the patient go into the right posterior lateral quadrant. Getting there any number of ways. You can have the patient extend and then side bend, or rotate and then extend, or just go on the diagonal. But the point is to see if the joints are moving well, kind of in between those standardized ranges of motion. It looks like this, where you kind of go back all the way into that quadrant. Again, you can go into any of them. For other patients, I might have them do a full neck roll and find that exact area where there's a disturbance and how the joints are working. A full neck roll might reveal that, oh, when I go down and to the left, right there is where it really hurts, where it wouldn't have been picked up on just with flexion or just with rotation to that side or side bending to that side. These are range of motion baselines, and doing a neck roll could be considered maybe a range of motion baseline, but also just kind of just a baseline test. These are not diagnostic. They're just getting the baselines. However, baseline testing informs possible diagnoses. So when there's a problem with moving into a range of motion, whether it's painful and or limited, it makes me think the likelihood of a mechanical joint derangement is high as a diagnosis. It could be any number of things. But when we get to part 3 and I do repeated movement testing, for example, if we did repeated retraction extension and then the problematic neck roll got better, or then going into that posterior lateral quadrant on the diagonal got better, that testing helps us think that yes, this is a mechanical joint derangement because we're seeing rapid changes in painful or limited range of motion that we took as baselines in part 2. So just keep in mind that if you suspect something's not working right in the neck, especially when it comes to joint mechanics, and you're not seeing a lot of evidence to that with the standard ranges of motion, look outside the box, look for the pockets of areas where the neck moves that might be problematic.